Pay close attention. What you are seeing today is fulfilling Bible prophecy.
Welcome to YPN News, bringing you news as it relates to Bible prophecy. Well, Jeff, embezzlement, money laundering, fraud, either way you slice it, it's stealing. And that's what our first of two articles has to deal with today.
That's right, Katan. In fact, this first article is one that may raise your blood pressure a little bit. It's viewed by some as the most important problem in America today, the healthcare crisis. President Obama says rising healthcare costs are driving huge federal budget deficits that threaten our future, and that there is enough waste and fraud in the system to pay for healthcare reform if it was eliminated altogether. At the heart of both matters is Medicare.
Now, Medicare provides healthcare to 46 million elderly and disabled Americans as the government's form of insurance. But it also provides a steady income for criminals who are finding new ways each year to steal a portion of the $500 billion that Medicare benefits pay out. Medicare fraud is estimated at about $60 billion a year and may very well be the most profitable crime in America.
As reported by 60 Minutes, an investigation was conducted in South Florida where Medicare fraud has surpassed cocaine as the major criminal enterprise. Those that suffer the most from this crime are the American taxpayers. The report showed numerous tiny clinics and pharmacies in low-rent strip malls with no one ever around. It is from these small facilities that large amounts of Medicare benefits are stolen.
Wow. In one incident, a medical supply company billed Medicare almost $2 million in July and $500,000 in August. But no one was ever found at the office and no one ever returned any phone calls.
Sometimes the offices do not even have a valid address. One pharmacy billed Medicare $300,000 in charges with an address that turned out to be in the middle of a public warehouse storage area.
Special Agent for the FBI, Brian Waterman, is the senior agent in the Miami office in charge of Medicare fraud. He stated, "There's a healthcare fraud industry where people do nothing but recruit patients, get patient lists, find doctors, look on the internet, and find different scams. There are entire groups and entire organizations that are dedicated to nothing but committing fraud, finding a better way to steal from Medicare."
In Miami, Medicare fraud has grown to be a bigger business than the drug business. Nationwide, $60 billion is stolen every year from Medicare.
Wow. Well, the taxpayers continue to take a blow, Jeff, as we come to our next article in relation to April 15th, which is, by most accounts, the deadline for filing taxes. Of course, this year we got a couple
two extra days.
That's right, April 17th. And to most Americans, this is usually the time known as the deadlines to file their income tax returns. But for a growing number of people, it's become a time when they realize they've been stolen from. The victims of tax fraud may not even be alive to realize this is taking place. CBS's John Miller interviewed a family who were the victims of tax return fraud. He interviewed this family whose son was a soldier and he was killed in Afghanistan. And when that family went to file his tax returns, they found out that someone had already beat them to it, collecting the $1,400 on a refund that should have gone to his parents.
This particular family was just one of many victims of a growing crime wave, tax return fraud. Illegally acquiring Social Security numbers and other personal data from both the dead and the living, and then file a return in their name. This is no small feat either. According to the IRS, tax thieves tried to claim $6.5 billion last year. Now, Ralfredo Ferrar, a federal prosecutor in Florida, said, "We see a lot of former gang members who are now involved in tax return identity theft schemes because it's easier, very lucrative, and, of course, less violent."
Electronic filing has made this form of thievery easier to do. The IRS doesn't necessarily cross-check employee records against returns before issuing a refund. Now, even the U.S. Postal Inspector, Tom Boyle, has seen where multiple returns were filed using just one stolen ID. Boyle also said, right now the IRS is so far behind in matching up information, it's months before they realize that the money has been stolen.
When asked who are the victims, in this case, Boyle replied, it's multiple victims. First of all, it's the person whose identity has been compromised. It's also the American taxpayer because they're paying hundreds of millions of dollars in a scam that's not going into the Treasury and, in fact, leaving the Treasury. In effect, a fraud against one taxpayer is a fraud against all taxpayers.
Now, the judgment against someone caught filing a fraudulent tax return is 3 to 4 years in prison. Now, you may be asking the question, just how are they stealing this information? Well, for the living, they acquire information from insiders who work at hospitals, clinics, companies, or schools. And those people buy that information in bulk. As for the dead, perpetrators scour the internet and obituaries for recently deceased persons and match birth dates with Social Security numbers.
Even in the mainland United States, crooks are filing fraudulent tax returns for people in Puerto Rico who are American citizens, but they pay their taxes to the Commonwealth of Puerto Rico, making it harder to detect when tax fraud has been committed. Qatar's $6.5 billion in tax fraud, $60 billion in Medicare fraud, all that money, all that waste, no real solutions. In fact, Medicare was created as a solution to a problem back in 1965, but now it's a problem that faces America today.
Well, I believe if they get back to the basic scriptures and following the laws written in there, both these problems could be eliminated. But to find out more answers and the real solutions, stay tuned as Yisrael Hawkins explains these scriptures as they relate to Bible prophecies. For YPN News, I'm Katan Alexander.
And I'm Jeffrey Heimerman.
Thanks for watching.